my data in and of itself is meaningless. It needs to enter into a framework, into a system for it to mean something. It needs to be compared to other people's data for it to have meaning. But if you would call it increased health, better well-being, better treatments for specific diseases, those are things that will incite trust in citizens.
AI algorithms needs to be trained and validated on data. The more data, the better accuracy. Keep the data at source, keep the data anonymized or de-identified, and enable the development of the AI around that, and keep the patient in the very center.
We developed and created this National Artificial Intelligence Lab in partnership between different public and private research institutions. And we have as goals for this lab to make sure that we make a safe and responsible use of AI for health, that we are able to translate our stored data, National Health Service data, into really useful and meaningful AI-backed tools, that we have a trusted environment to test and scale up innovative IT solutions, that we have established partnerships for this testing within a national health service.
We need to have this legal interoperability in place. We need to have also a policy interoperability, also the technical and organizational and semantic interoperability, of course.
This is very resource demanding. We did the first primary calculation about what it would cost us to take these all needs into account and get this electronic health record up to date. The first calculation was that for 10 years, including the maintenance cost, it would be 100 million, which is a little bit less than half of our annual budget of the hospital altogether. How can we bring this resource question also to the level which is acceptable and that we can deal with?
Data is individually valuable and collectively powerful because when each patient understands that the data is really important to share with the academics and the industry, and when this data producer really understands that behind each line of data there is an intimacy, there is a patient, there is an individual, maybe we can find solutions.